Awesome. It's great to be here, and let's get started. I will go ahead and share my screen. Let me find the right
Good.
one. And here we go. Can you see, can everyone see me or
Yes.
hear me? Awesome. So we'll get started, and yeah, it's really good to be back. As you heard, the my lecture today is called "How to Make Aging Optional." And my website's just drjosh.com, drjosh.com. I will try to make this interactive, but we'll save longer questions and topics till the very end. So definitely hold on to your questions because I'm sure you will have many. And and you'll learn that eating whole plants is a great start, but there are other things we can do too. So, and this is also a very personal journey. A dozen years ago, before I found the real truth about health, I was 50 pounds overweight. This is me on the left side of the screen. 50 pounds overweight, had high blood pressure, but I was like a Harvard trained physician. Like, why couldn't I figure this out? Why couldn't I fix this? And it was not until I found a more integrative, holistic approach that I came to the solution, which you can see me on the right side after losing the 50 pounds and controlling my blood pressure. So again, this is personal because I've been able to do this for myself, and I want to share this with everyone else. So more about me, 2 degrees from Harvard, a former and current medical director at Hippocrates, 2 degrees in biochemistry. And you heard that I worked at True North, where people would spend lots of money with us, and all we would give them was water. But that's because many of their chronic diseases would go away and they would get younger. My focus is now on longevity and reversing Alzheimer's. And if you stick around a couple of days, you'll hear my lecture on Alzheimer's reversal. And I went to a joint Harvard MIT program. I'm also currently the chief medical officer of Brain Power Clinics and Alzheimer's Treatment Centers of America. And you can find me on social media under GreenBrainsMD. And I also have a weekly podcast on reversing Alzheimer's. You can find on YouTube or at drjosh.com/podcast. All right. I also start, you've seen many disclaimers, and I apologize for having my own, but basically this is not medical advice. Um, if your own doctor doesn't feel comfortable with these topics, seek out someone like me uh, for help. And I'm not being paid by the big food or big pharma. I do offer an FDA-approved drug for compassionate use to reverse Alzheimer's, and I'll talk about that in a couple of days on my Alzheimer's lecture. Okay, so now that we get started, sorry for boring you there. Queen Elizabeth II died in 2022. What was the cause of her death on her death certificate? And if you could type into the chat here, if any of you know or what you think was the cause of her death listed on her death certificate. Old age. Wow, Rachel got it right. Congratulations. And Crystal did too, and Juliana. Wow. I have a really smart audience here. I don't, I can finish here. No. So what's interesting is that was the case. And let's actually take a look. If we zoom in on the death certificate, it's public record. You can see it was old age. Now, what we've since learned in the last couple years is actually it was bone cancer. But this is the whole point of this lecture, is that if we can turn back aging, then many of the chronic diseases like cancer, you're less likely or you won't get. So again, if we can turn back your biologic clock, we are going to prevent all these other chronic diseases. And I respect that the Queen, like other people, they want their privacy and they don't really want everyone knowing about bone cancer, but let's keep going. So old age, and yeah, that's not a picture of her, but yeah, sometimes we can tell people are old just by looking at their face. Okay, so let's start with the basics here. What in the world is aging? And if you look it up in Wikipedia or in a dictionary, do they still have dictionaries? Anyway, so aging is the progressive physiological changes in an organism that lead to senescence. Great. Don't you love these dictionary definitions? Then what's senescence? A decline of biological functions and of the organism's ability to adapt to metabolic stress. All right. So, and today I'm going to be talking about reversing aging, reversing that process. And this is not new to me. People have been looking for this concept for hundreds of years, specifically the fountain of youth. And Ponce de Leon reportedly found it in St. Augustine, Florida. I'm in West Palm Beach, Florida, but you could go to St. Augustine, Florida today, and yeah, you can find the fountain of youth there. But I'm going to argue that the fountain of youth is not in that location necessarily. It's if you have the right lifestyle, which involves what you're eating and other things too, which we'll get into. Okay, so I also like to start my presentation with a summary in case you get really bored with what I'm talking about or you have to step away. So here it is, the summary, the top 10 ways to make aging optional. Here they are. Number one is eat plants, exercise, avoid processed food, reduce stress, smart supplementation. I'm going to talk about lots of different supplements, but the four I'm going to highlight are NMN, nitric oxide, hinokiol, and pectisol. And it's okay if you haven't heard about any of those. That's why I'm here to cover these issues. The next one is fasting, optimizing sleep, tracking your own health, avoiding hospitals, and finding a sense of community. All right, so what sort of diet should I eat? And I know there are many lectures here on and there are going to be some similarities and differences on what you're hearing through this seminar, through all these lectures. I'm going to share with you my opinion based on my clinical practice for many decades and my 2 degrees in biochemistry and real world experience seeing what works and what doesn't work. All right. So I would argue you should be eating whole foods, plants, vegetables, whole grains. And this is one area where I know there is controversy, but it's obvious which camp I'm in. No added salt, oil, or sugar. We call it SOS free. And the reason I'm a fan of no added salt, oil, and sugar is that the research studies in humans have shown that when you eat a diet that has added salt, oil, and sugar, it does damage to your blood vessels. And it turns out that your blood vessels are a big determinant of of how you age and your overall health. So, all right. So the next question, and maybe you know, I know in the audience there are definitely some vegans. I know that there's some who are exploring. I personally was exploring um, 10 years ago when I lived in Orlando, and this conference was physically in Orlando, Florida, and I got to go to in person a lot of these lectures. And I was a little bit skeptical, but I'm so glad I came to the real truth about health when it was in person. But anyways, does being vegan increase your life expectancy? And the answer is it does. This is a study of over 73,000 Adventists comparing the death rate, deaths per 1,000 person years of the vegans and the animal eaters. And the vegans had a death rate of 5.4, and the animal eaters had a rate of 6.61. So obviously, 6 is more than 5. So why? The next question may be, why do vegans live longer? And there are many different answers. So here are some of them. Plant eaters have a lower risk of heart disease because a vegan diet is often low in saturated fat and cholesterol, and that can lower the risk of heart disease. Next, Vegans have lower risks of certain types of cancer because a vegan diet is rich in fiber, antioxidants, and phytochemicals. All have been linked to lower risk of certain types of cancer. And in animal products, meat, dairy, cheese, there's zero fiber. Next, lower rates of obesity. Vegans tend to have a lower body mass index compared to the meat eaters, and that's associated with a reduced risk of obesity. And it's really interesting that we now know that being overweight or obese speeds up your aging process because the excess fat, whether it's around your middle or in your bottom or both, the excess fat cells release inflammation, and that inflammation triggers early aging. And some people have called this inflammaging, if that term helps you remember it, but inflammation is not good for turning back your biologic clock. And then next, vegans tend to have better gut health because their diet is higher in fiber, which promotes a healthy microbiome and can reduce inflammation. And then plant eaters have better control of blood sugar and specifically improved insulin sensitivity, which lowers the risk of type 2 diabetes. And then finally, and this is really important, vegans are exposed to lower levels of toxins because the higher up you go in the food chain, there are much higher amounts of toxins. You are what you eat. If you eat from the top of the food chain, if you're eating chicken and beef and dairy and cheese and fish, that's the top of the food chain. Those animals have much higher levels of toxins than if you're eating plants from land or sea. So, and we'll get into toxins. I hope not to put everyone to sleep, but toxins are really important when it comes to aging. All right. So when I use the word toxins, I'm not talking theoretically. I'm talking as with 2 degrees in biochemistry. I'm actually talking about substances. So what are some of the examples of toxins that I'm talking about? Well, let's talk about some. These are not all. Here are some of the toxins in meat, if you choose to eat meat. The first one is heavy metals. Then we have plastics. Many plastics are obesogens, meaning that they lead to obesity. Estrogens, and let me be clear, you often see some meat advertised as hormone free. That's a misnomer. What they're saying is they're not adding extra hormones to the animals before they kill or harvest them. But guess what? A cow, a chicken, a mammal, animals have hormones because life is not compatible not having hormones. So even if you're having hormone free chicken or beef or other animals, there are still estrogens and other hormones there. Next, we have pollutants, man-made pollutants like PCBs and dioxins, pesticides, endotoxins. Endotoxins are interesting. Endotoxins are the cell wall of bacteria. And yeah, we all have some endotoxins that we produce in our own gut. But if you're eating other animals, those animals are not produced sterilely. So if you're eating beef, chicken, fish, you're also eating the endotoxins that are present in that meat. And it turns out that endotoxin is one of the best ways to stimulate your immune system because your immune system recognizes like, hey, this is not us. This is bacterial cell wall. You've got a problem here. And that inflammation is related to aging, as I mentioned earlier. Okay. Next, you've got new 5GC, which is sialic acid, heme iron, antibiotics, heterocyclic amines, polycyclic aromatic hydrocarbons, advanced glycation end products, TMAO, and most importantly, you've got oxidized cholesterol. So there is no cholesterol in plants, but if you eat animals, animals have cholesterol. And if you're cooking the cholesterol, I'm sorry, if you're cooking the meat, which most people do if they're taking meat in, the cooking process causes the cholesterol to oxidize, and oxidized cholesterol is very reactive, very inflammatory, and does damage, which then leads to premature aging. Okay. So, where do people get dioxins or these other man-made chemicals from? This is government data from the EPA, and it just shows you um, the primary sources are beef, dairy, milk, chicken, pork, and fish. There's a small amount in eggs, even smaller in the air to inhale. There's a small amount in soil, very small, negligible amount in water. But let me just be clear. So I'm not saying if you cut out all animal products and just eat plants, you're going to get zero dioxin. You're just going to get a much lower dose, 10 times less. But that makes a difference when we're talking about exposure day in, day out. Oh, I should also say these fatty toxins, like dioxin, can have a half-life of 10, 20, 30, 40 years or more. Once they go into your fatty tissue, they're not coming out. So it's a problem. All right. So what are fatty toxins? Here's some examples. You've got saturated fats. You've got trans fats. So trans fats are interesting. There are fats that are man-made in order to prolong the shelf life and make foods taste better. And unfortunately, trans fats uh, cause inflammation and are not healthy for people. Now, there was recent regulation in the United States saying they have to take trans fat out of processed foods, out of foods, which is good. It's good news that people are eating less trans fat in foods, in processed foods. But what's interesting is animal products also have trans fats. So if you're still eating beef, chicken, fish, you're still getting a large dose of those trans fats. But of course, when you buy some beef, there's normally not a sticker on it that tells you how much trans fat, but it's there. Just like there's no sticker telling you how much estrogen or plastics or these other toxins there is. Okay, so the next category of fatty toxins are omega-6 fatty acids. And omega-6 tend to be the more inflammatory fatty acids that the use of has exploded in this food supply in this country. And yeah, you want to limit your amount of exposure to omega-6 fatty acids. And one way to do that is just to cut out processed foods. And then the next category on this slide are mycotoxins or mold toxins. So, for example, black mold can produce um, a, a toxin called trichothecene, and that um, black mold toxin, it can actually go in through the eyes. It hangs out. It can go into the brain and stay there for decades unless you do something to get rid of it. All right. I know this is doom and gloom. There's some good news coming. All right. So other toxic fatty compounds include PCBs, which are polychlorinated biphenyls. You've got DDT, which is dichloro-diphenyl trichloroethane. And then you've got these PFAS forever chemicals that are found in Teflon. They're found in clothing that's stain resistant. And unfortunately, these chemicals are now in our food supply. So if you're eating animals, you're getting a much bigger dose of these. And then petrochemicals, in our modern society, we use petroleum, and some of the petroleum derived chemicals are fatty and toxic. So this study is from 2017. It was a French study showing that basically you are what you eat. So it compared vegans to animal people who are eating animals to look at how many of these fatty toxins, the furans, dioxins, and PCBs, there were in the two groups. And it turned out that the vegans had 10 times less of these fatty toxins than the meat eaters, which makes sense because you are what you eat. If every meal you have, say, 10 times as much dioxin and PCB, it makes sense that when you look in the body, you're going to have 10 times more of these toxins. Another name for these toxins are POPs, persistent organic pollutants. Okay. And how do PCBs and similar toxins build up in living people? Two different ways. One is over time, the longer you live, there's more accumulation. We call that bioaccumulation. And then up along the food chain, we call that biomagnification. And this is an example of PCBs in the water. If you look in seawater, the level of PCBs is 0.000002. If you go a little bit up from the seawater, you find plant plankton, um, and that level is 8. And then if you go to fishes, that level is up to 37, birds 110, and then marine mammals 160. So again, I'm not saying if you're eating algae or other plants from the water that you're gonna have zero exposure to PCB. It's just gonna be a lot less in comparison to if you're eating fish or other meat. Okay. So great. So if you're like me, it's like great. I found out this information. Well, how do I remove these toxins? And I remember when I was in my residency in Detroit in emergency medicine, going to a toxicology lecture, and I kid you not, they were laughing. The professor was laughing when talking some of these toxins like PCB. They said, yeah, or dioxins. The only way we know how to remove these toxins are if you happen to be a woman who's breastfeeding or a woman who gets pregnant. Some of these toxins will go to the placenta and the developing baby. So, I mean, it's unfortunately it's tragedy. It's not funny. It's a tragedy. And the good news is there are other ways to get rid of these toxins besides being a female and having a child. So one way, let's talk about one way is with binding agents. And one of my favorites is called pectisol or modified citrus pectin, which does many different things. And this is what it looks like, pectisol. It is a natural chelator of heavy metals. Now, there are other binders that I normally recommend, things like zeolite or activated charcoal, but I normally recommend people start with pectisol because it's a lot less harsh on the gut. Now, this is also interesting. This binder pectisol also inhibits a protein called galectin-3, which is associated with inflammation. Now, many of you have heard of lectins. Specifically, you may have heard of Dr. Gundry saying, oh no, don't eat vegetables because they have lectins. Well, guess what? People have lectins too that we produce. Specifically, one of them is galectin-3, and galectin-3 is normally part of our immune system when it's functioning, but when things are abnormal, if their inflammation is revved up, galectin-3 levels can be too high. So I'm going to pause right now, and I've got an interesting question. What are my thoughts on algae that's grown in closed algae farm pools versus algae that comes from ocean, but the oceans are polluted? So first of all, I think it's much better to take algae in than eating fish. Um, but yeah, I think algae is probably better um, from a farm than the ocean. Oceans are definitely polluted, but farmed farm pools can also be polluted. I think the key when it comes to algae is you need testing for these different toxins and wherever they're being sourced and purified. You want to test the end product, make sure there aren't a ton of heavy metals wherever it's being sourced. And the sad thing right now is wherever you are in the world, um, and I'm sure this was different hundreds of years ago, but right now, if you're eating fish, um, the waters are polluted, whether it's farm raised or ocean raised. There's literally plastics. They found plastics everywhere in the world, including in the oceans. All right, so let's go back to talking about Pectosol. It inhibits galectin 3. And the dose I normally recommend is 6 capsules twice a day or 5 grams of the powder twice a day. And the key with binding agents like Pectosol is you don't want to take it at the same time that you're taking other supplements because basically it will bind those other supplements. You want to take it on its own an hour or two separate from eating anything else. Okay. So, going to talk a little bit more about this galectin 3, which is associated with lots of chronic diseases which lead to premature aging. It's a lectin. It's secreted by activated macrophages. What are macrophages? Macrophages are white blood cells you can see under a microscope that look like Pac-Man. They're basically eating up cancer cells and infection. Okay. It was actually galectin 3 was discovered in humans in 1994, but it's only more recently we've connected the dots and said, ooh, this galectin 3 levels are too high in all these different chronic diseases from A to Z. And here's a busy slide from A to Z, from asthma to zoster, from rheumatoid arthritis to inflammation, all these conditions that are cancer even that are associated with premature aging. And here's the next question we have. What do I think of EDTA cream that's applied to the skin? Are you concerned about this or Pectosol or zeolite affecting beneficial minerals? Um, I mean, I think when we're talking about binding agents, sure, you worry that is it also going to bind up to magnesium or other minerals that you need, and it may. And the way around that is you measure it. You measure your magnesium level and your potassium level, and make sure that your minerals look good. All right. But I'm not opposed to an EDTA cream. I'm just not sure how effective. Normally with EDTA, which is pretty harsh, it's a detoxification agent. I've used intravenously. I normally use other ones first, but that's my opinion. Okay, so heavy metals can be toxic, including mercury, lead, and cadmium, and many others. And you've seen this slide. Okay, where can you get Pectosol? Here's one place. You can go to drjosh.com or to echonugenix.link/drjosh, DRJOSH, and the discount code for 20% off is drjosh, DRJOSH. All right, so that's that slide. And so here's another approach that I want to say is new, but it's not new. Another approach to removing toxins. It's actually been around for over 50 years, but we're starting to apply it to remove toxins and to prolong lifespan and health span. It's called total plasma exchange. It's a form of dialysis. And it's become popular because of anti-aging guru Brian Johnson. I went to his conference in Miami a couple weeks ago. It was a lot of fun. Do not die. But basically, this is a picture of him getting total plasma exchange. You basically take blood out of one arm and you get rid of it. You waste it, and then in the other arm you put in plasma specific. You put in albumin, which is basically a protein. So the blood that has the toxin you get rid of, and that's how you get rid of the toxins, including the heavy metals and the plastics and the forever chemicals. So I just have to share with you, I'm really excited that we now have ways to get to truly detoxify the body. And a little bit more about Brian Johnson. He spends a couple $1 million every year to avoid aging. He, of course, has adopted a vegan diet because his team of 100 experts, physicians, etc., have shown in the data that if you want to live longer, eat plants. don't eat animal products. He takes over 100 supplements every day. I'm not saying everyone else needs to do that, but I do credit him with being willing to do an experiment on himself and share that experiment with everyone. And I love the fact that he said, like, hey, I tried rapamycin and it aged me prematurely and I stopped it. Now we could have a whole other discussion, like maybe the dose of rapamycin was too high. Um, I know he's a fan of olive oil, and I asked him point blank because he's all about, I like to test. I said, did you test yourself before and after you added olive oil? He said no. So, but he's marketing olive oil, but that's a whole other exchange. So, um, a whole other issue. But yeah, the fact that Brian Johnson is using total plasma exchange to prolong his life, that's definitely gotten this on the map. And in one of my clinics, I am using total plasma exchange to reverse Alzheimer's and get toxins out of the body. That one is called the Alzheimer Treatment Centers of America. It's difficult to find a center to do total plasma exchange today, but that's changing as this information is getting out there. And yeah, so Anna wanted to know where you can do total plasma exchange. You can come down to Port St. Lucie, Florida, to my clinic. Um, but the cool thing is, almost any big city now, you're going to be able to find a center. And then Beth asks, if we donate plasma, could that actually help us detox? The answer is yes. Um, Donating plasma or donating blood is actually good for your own health. And do they filter it before it goes to other people? Yes, they do. But taking a step back, are there still toxins that end up in other people when you donate blood? And the answer, unfortunately, is yes, too, because they're not completely removing all the heavy metals, plastics, pesticides. And I think once this information tips and the general public starts being aware, there's going to be it's exciting because there are going to be um, for people like Brian Johnson who've been through total plasma exchange, their blood is going to be more valuable as a donor because they don't have all the other toxins that you would normally get if you donate blood. Um, if you're just getting a random donor out there. And Nash says donating blood also reduces iron from the blood to avoid iron overload. Right. Yeah. So a lot of people have too much iron. And so that's another reason why I recommend donating blood. Great questions. Keep them coming. All right. So longevity and toxins. Wendy says one wants to make sure of getting donated blood is if someone had gotten the COVID jab. I think there are separate places to get blood from unvaxxed people. That's awesome. I think that's a good point. So I wasn't aware of that. Thank you. Okay. So longevities and toxins. We're talking about how to make aging optional. And you may be like, great, I'm vegan, but what else can I do to improve my lifespan? Well, guess what? Vegans can age too if they make the wrong choices. So I want you to stop eating carbonated drinks, refined sugars, artificial foods, and processed foods. Yeah. And as I mentioned before, you want to avoid adding salt, oil, and sugar, even olive oil, even though, I mean, I've had olive oil companies approach me and wanting to advertise on my podcast, and I couldn't take their money because I'm lecturing, don't use olive oil, at least in mouth. I think olive oil is fine on the hair, on the skin, and I think honestly, that's the ancient Greeks. I don't think they used a lot of it internally. I think it was mainly used on the hair and on the body. And someone wants to know, did I read Dr. Michael Greger's book on how not to age? Yes, I love that book. It's a great book. Okay. So it is possible to be an unhealthy vegan, definitely. So, for example, in the United States, Oreos are vegan. If you're eating Oreos every meal, you're not going to be healthy, unfortunately. So, processed food is not health promoting. I wish it was, it's not. So, and this is a confessional photograph. This is me and my son Jason a dozen years ago. Jason's now in college, doing fine. But here I am. Thought I was being a good dad, giving him an ice cream cookie, and yeah, I know better. But yeah, avoid processed sugar for yourself and your family. And Lucia wants to know, what about organic extra virgin olive oil? Yeah, so I think that's fine to use on your skin or your hair, but I would not recommend taking it internally for many reasons, including the fact that it causes sludge blood after you eat a fatty meal, including olive oil. It causes inflammation. If I, after you eat some olive oil, even extra virgin, if I draw the blood out 5, 10 minutes later, I'll actually see at the very top the olive oil will sludge out. And if I look under a microscope, I'll see red blood cells stacked up. They're called rouleau, and you see that with inflammation. But why? Many studies show it has anti-cancer properties, even meta-analysis. Yeah, but you have to look at those studies and say compared to what. So I understand this is a 2 hour lecture with Q&A. I don't have time to go over all the papers on this, but I would also caution you, there's a lot of money. Olive oil is a $1 billion business. There's a lot, and I said no to their money. They want to advertise on mine. Uh, so you have to take some of these studies with a grain of salt. Okay. So how does added sugar cause aging? Um, well, the next question here is, how about pink Himalayan salt? Is it okay, or sea salt? All right. So I love the Himalayan salt lamps that they give off kind of a nice yellow color. So for lighting, I think Himalayan salt is awesome. I For most people, I would not recommend eating it because of the excess sodium that causes damage to blood vessels. Now, there are some people who are exercising outside, sweating 3 hours a day, ultra marathon runners, where yes, they need to replace the sodium. But for the average American, no, you don't need extra salt, including Himalayan salt or sea salt. Okay, so how does added sugar cause aging? One way is when you take in a sweet meal, you get sugar spikes that lead to increased insulin levels. Another is via advanced glycation end products, which this is really interesting. Um, if you can imagine you're eating lots of foods that have added sugar, that added sugar some of it ends up in the bloodstream, and in the tissue, it ends up caramelizing your tissue, the proteins, it destroys them, the extra sugar. So you think, oh, caramelization is a good thing. It makes something sweet. Yeah, but unfortunately, we don't want to caramelize our tissues. So that process is called advanced glycation end products. And what's interesting, if you look up olive oil, the favorite out there, olive oil, because it's a highly processed food, olive oil also has these advanced glycation end products. So yeah, that's another reason to avoid olive oil. And DA wants to know, what about eating seaweed? So I'm a fan of seaweed in general, but I caution you, most seaweeds are extremely high in iodine. So if you're eating seaweed every single day, not so much nori, but the other seaweeds, you're getting 1,000% of the USRDA on iodine. Now, it's true, a lot of people are deficient in iodine, but iodine's one of those minerals you don't want to be too low or too high. If you're eating hajiki seaweed every day, your iodine's going to be too high, and then you may end up with thyroid problems. And and we're going to hold off on questions till the end. So definitely hold on to them, and we'll get that in a little bit. All right. So, and then avoiding added fat. So one of the comments was, what about studies? Here are 5 studies showing the damage from adding fat and oil, including olive oil. From the study by Vogel in humans, olive oil showed, after you eat a meal with olive oil, it showed decreased flow mediated dilatation. What does that mean? It means the flow through our blood vessels slowed down, because the oil was damaging the endothelium, the one cell thick layer that lined the blood vessels. How is that happening? It's really interesting. The way it happens is red blood cells are normally very smooth biconcave. But after you eat oil, including olive oil, those smooth red blood cells develop spikes. And then those spikes on the red blood cells do damage when those red blood cells go through the capillaries, the narrow blood vessels. So, and then there's the art, article from the study from Ruda Clausen, olive oil, soybean, and palm oil all created a 31% endothelial impairment. Endothelial is that lining, and increased triglycerides. And then even the Mediterranean diet, we hear about, oh, the Mediterranean diet's really good with oils, including olive oil. They saw 25% had major cardiac events at 4 years. So again, all the olive oil industry has done an amazing job marketing. I'm just saying, if you actually take a look at the studies, you do not want to be adding oil, highly processed food. With a few exceptions. Like if you're super skinny and I'm trying to put weight onto you, it makes sense you would use the most calorie dense foods, the fats and the oils. And yes, there are a few people in the audience watching this who need to gain weight, but that's not most people. So, all right. Last year I was on The Real Truth About Health with Dr. McDougall. Unfortunately, he passed, but I love his quote: "Olive oil is toxic for humans. All oils are." He's right. Our ancestors thousands of years ago did not have ready access to all these oils. And here's one: all five fats tested, which included canola oil, olive oil, sunflower oil, palm oil, and butter, cause increases in blood triglycerides and clotting factor number 7. And that's not good. Now, you can do a study saying, look, olive oil is not as bad as butter. And that's true, but that doesn't mean that you should be eating olive oil. Now, I understand some people watching here are making a transition from just eating the Western standard American diet. And to you and to everyone, I say, take your time. I'm not judging you. I'm not here to judge you. It took me years to make the transition. So I'm certainly not in a position to judge anyone else. But what I am going to say is don't let all this information stress you. Use it to transform. All right. So this whole field of longevity, it feels like science fiction, because if I was having a discussion about this a dozen years ago, I'd be like, this is unreal. I don't, maybe someday, but I'll show you in a second. So imagine turning back your own biologic clock or that of your pets. We can do that today. It's crazy. Or imagine cloning people. It is technologically possible today to convert skin to egg and sperm cells. Again, I'm not recommending we do that. They may be doing this as we speak, secretly somewhere in Asia. Not a fan of it, but the fact that technology has exploded exponentially, it's amazing. All right. So, one criticism or feedback I've gotten from this lecture is, I want to wait until this is settled science. The problem with that is, do you want to wait 50 or 100 years for this whole longevity field to be settled science? I don't know about you. I don't have an extra 50 or 100 years, which is why I'm willing to do the research and try some of these on myself, like Brian Johnson. And the other thing is, do you want to be in the control, the placebo group? Again, I'm okay if you do in a longevity study. All right, so why in the world is this important? We're trying to trick the body to slow down aging. Another term for this is biohacking. All right, so wellness starts at a cellular level You want to start with nutrition, movement, rest. You want to reduce your toxins, inform self-care. And yeah, if you have a true illness, I have nothing against, or a car crash, I have nothing against going to the hospital. But the whole point is we want to avoid you needing medical care. So the five pillars of metabolic health are healthy eating, daily movement, healthy connections, stress management, and smart supplementation. Now, if you decide to do this and have optimal metabolic health, you may look different than the average American because only 7% of Americans have optimal metabolic health. So if you're in that 7%, you may not be eating the things and doing the things that the average American does, and you have to be okay with that. So this is one of the interesting findings in the last dozen years. It turns out that metabolic health and biologic age are inseparable. It turns out that the mechanism in our cells that determine aging are the metabolic clock. All right, taking a break here. The Who, My Generation. Hope I die before I get old. Well, what is getting old? Or how about this one? Don't trust anyone over. Yeah, fill it in. What do people think here in the chat? Don't trust anyone over 30. Yes. But yeah, I don't know about you. I'm over 30. So don't trust anyone over 60? Or is it another number? Okay. So you want to choose your health span and your lifespan wisely today. And here's the new paradigm. Most physicians are not studying or practicing longevity medicine. Now, the interest in this field is growing exponentially, and there are physicians like me actively studying this and pursuing it. But let's just be clear, it's not the average physician out there. Your primary doctor probably doesn't know or care to understand or learn most of what I'm sharing. In fact, the truth is we don't need doctors for most of this movement unless they're willing to pivot. So I love that Dr. Clapper's devoted his life now to educating medical students and getting them to see this whole picture. But my point is, let's take this movement to the public and go with it. We don't need the medical system as it stands right now. So here's a complicated graph, health span versus lifespan. And what this graph basically shows is that we're not talking about giving you an extra 30 years so you can spend those 30 years in a nursing home completely gorked out and non-interactive. What we're talking about is we want to extend not just how many years you live, but the quality of those years. And the exciting thing is you can extend both some of the existing technologies we have today, and the technologies are getting better. So here's some of the nitty-gritty biochemistry, and try not to glaze over. You can tell I love biochemistry. So we when we study people, the hallmarks of aging appear by age 25. As an example, we see NAD plus levels drop. NAD plus is a molecule critical to metabolic function and DNA integrity. And then because the NAD plus drops, metabolic function declines. So NAD stands for nicotinamide adenine dinucleotide, critical coenzyme found in every cell in your body. It's involved in hundreds of metabolic processes. Here's another molecule that we also see by age 25, nitric oxide. Nitric oxide is one nitrogen and one oxygen atom stuck together. It's critical for relaxing blood vessels. It's a gas. And when nitric oxide levels drop, vascular function, the health of our arteries and veins and lymphatics, the vascular function gets worse. And this is just an illustration that when we're young, maybe 20, we have 100% of our nitric oxide concentration. As our arteries get damaged, we could go down to 15%, extremely low levels. So The theory here is smart supplementation, specifically using NMN and nitric oxide, NMN to increase NAD, and nitric oxide to improve the amount of nitric oxide in our blood vessels. And with the two ends, the way I remember this is fountain of youth. Fountain has two ends. You got NMN and nitric oxide. I think virtually everyone over the age of 25 should be on these two supplements. That's my opinion, but I'll share with you more. So the best way to increase the NAD levels is to supplement NMN, in my opinion. NMN is nicotinamide mononucleotide. And this is for the biochemistry nerds out there. This is the structure. And all right. Where can I get NMN? Well, you can't get it on Amazon in the United States. You can't get it at Walmart. The FDA has restricted it. Fortunately, you can still get it. My favorite place is a company from England called DoNotAge.org. DoNotAge.org. You can use, again, discount code Dr. Josh, DRJOSH. And then the dose I like is 1,000 milligrams or 1 gram to start with, but everyone's going to be different. And how do you know that you're taking too much? If you're all energetic and you can't get to sleep, that's probably too high. You need to back it down. Okay. And I'm talking about NMN, not M&Ms. Yeah, M&Ms are not health promoting, I wish, right? Plus, look at this. They have artificial flavors. Like, why would you do that to your health? Don't do that. Okay. And then how can I get more nitric oxide, NO? And this is nitric oxide. There's a comment here, nitrous. No, I'm not talking about laughing gas. That's a different form of nitrogen and oxygen gas, not this one. Where can I get nitric oxide? Green leafy vegetables and beets. And specifically, what you want to do is you want to chew your green leafy vegetables and your beets. And when you do that, you get a boost of nitric oxide for about 2 hours. Now, the key, though, is you don't want just 2 hours. For longer acting nitric oxide for 24 to 36 hours, I like a supplement like Cardio Miracle, which is a powder you mix in water, you swish it in your mouth, and you swallow a couple times a day. And then you can get that at cardiomiracle.com/Dr. Josh, DRJOSH. Okay. Next, talking about caffeine. Caffeine inhibits nitric oxide. So that's one of the many reasons I am not a fan of caffeine. Let me share with you a bunch of other reasons to avoid caffeine. Number one, caffeine lowers blood flow to the brain by 27%. Not good. It's a brain cell excitotoxin. It's an immunotoxin. It increases the risk of diabetes. It mimics stress. It decreases healing with neuronal injury. It increases your risk of seizures. Oh, yeah. And it increases your risk of this heart arrhythmia called atrial fibrillation. I am not a fan of caffeine. Okay. So another smart supplement, just changing gears here, that I like is called Honopure, Hinokiol. This is a structure with the two connected benzene rings. It's also called Hinokiol or Honopure. It's extracted from magnolia bark, so it's a natural product. It's anti-cancer, neuroprotective, anti-inflammatory, and it improves mitochondrial function. The dose I recommend is 1 capsule twice a day. And this is what it looks like, the bottle, Hono Pure. And you can get it from the same econugenics.link/Dr. Josh, discount code Dr. Josh, 20% off. All right, let's see here. Exercise. Exercise actually for reversing aging is better than any supplement I can imagine. And when I say exercise, I'm talking about regular physical activity. So you know what? Whatever exercise you like doing, do it. So Exercise will prolong your lifespan and your health span. So I'm a fan of aerobic exercise, which will increase your heart rate, get you sweating, which will get toxins out, including HIIT training, high intensity interval training. I'm also a fan of muscle building, which is strength training. And don't forget balance, because the last thing I want to see happen to you is as you get older, if you trip and fall and break a hip, and then your mortality rate's 50% for the next year because you can't get out of bed, so you get pneumonia, blood clots, things like that. So ideally, you should be working on all these things: aerobic training, muscle building, and then balance. So I want you to imagine a world where it wasn't acceptable to say, you know what, live with that disease and pain. That's just a part of normal aging. And I'm really upset about this because literally I see patients every week who their primary care or specialist doctor who they went to see basically said, you know what, you're getting old, just there's nothing we can do to help that. So what I'm here to tell you is there are things you can do about that. You just have to take it into your own control and be your own advocate for health. But at least as we're here in April of 2025, the current law in this country, in the United States, is not very helpful. The Medicare guideline section 2251.3 says a treatment plan that seeks to prevent disease, promote health, and prolong and enhance the quality of life, or therapy that is performed to maintain or prevent deterioration of a chronic condition is deemed not medically necessary. So often patients will come to me and say, well, will my insurance cover this test or this procedure or this supplement? And often the answer is no. But I tell them, look, we're in a backward system. We're in a disease management system where you basically have to wait until you've got an end stage, very difficult to treat disease, as opposed to putting the resources, money, time into preventing it in the first place. So hopefully you're willing to put that energy, and I think you are because you're actually watching me talk about this, which is awesome. So it turns out that aging is a recent problem because our ancestors were much more likely to die from infection, trauma, and starvation than from old age. So, it's kind of cool that we're having this discussion that we don't have to worry as much about infection, trauma, and starvation right now. Okay. And then the philosophy of longevity medicine is that prevention is a smarter approach than our existing disease care system. As an example, wouldn't it be nice to catch cancer early? Well, there are blood tests, including the Grail-Galleri multi-cancer early blood detection test I do for my patients, and it detects over 50 types of cancer. I'm aware of no type of cancer where the results are better if you catch the cancer at a later stage. So cancer is much easier to treat often if caught early, but our disease model insurance won't normally cover this test. They make you wait until you have the cancer diagnosis, the advanced cancer, and then they're willing to pay to treat it. It's kind of crazy. And yeah, hopefully RFK Jr. will make some changes. I'm optimistic. All right. So the top chronic diseases are all caused by aging, whether that's heart attacks, stroke, dementia, Alzheimer's, cancer, diabetes, or even just simple arthritis. So the point is, if we can turn back aging, we can hopefully prevent all these diseases. There are many different types of biologic clocks, age clocks that we can use. And the exciting thing is this is all new information in the last dozen years. So here are 5 different types of clocks, and we as scientists found this accidentally. So we've got the telomere clock. The telomeres are caps on chromosomes. We've got epigenetics, changes in genetics on top of genetics using methyl or carbon with 3 hydrogen groups to change the expression of the DNA. We've got transcriptomics with RNA. We've got proteomics looking at the proteins in the blood. And then we got metabolomics looking at metabolism. And if you can see the busy um, graphs at the bottom, The point is that there's a strong correlation between biologic age and chronological age. There's basically a line. Are there outliers? Yeah, there are definitely some outliers, but there's definitely a close relationship. And these clocks were found by accident. We didn't know a priori that we were going to find this information. All right. So our goal is we want to reset. If we want to turn back the clock, there's three different levels of biologic aging clock resets. And here are the three levels. Level one is changing the transcription factors. For example, if you go hungry, skip breakfast, or go exercise, that's level one. Level two is if you silence genes like sirtuins, let's say you take some NMN or a prescription drug like metformin, that's level two. It's not permanent. You have to take, I recommend people take NMN and nitric oxide every day, and Hinokial too, for that matter. Now we're not here yet, but I think we're close. Within the next 5 years, we're gonna see level three, a master DNA clock, um, uh, a master permanent reset. So something to look forward to. All right. And then methylation caps, this epigenetic on top of the genes, are placed on different parts of the DNA to change the gene expression. And what I find fascinating, it's the same biologic clocks in humans, in dogs, in cats, in plants, in yeast, that this clock was conserved. It was so important. And it's so important because it's tied into metabolism. So both aging and metabolism are vital to the life and death and survival of cells. So do different organs age at different rates? Definitely. So for example, the brain ages more slowly than the skin because the brain is protected by a nice bony structure that keeps out radiation, whereas the skin, when you go outside, you get lots of exposure. All right, so how can we measure aging? Well, there are lots of ways. One is the traditional ways. You look at someone's appearance, you look at their face, and it turns out that's pretty good. Now, people can have plastic surgery, but it's like, yeah, that looks like plastic surgery. Okay. Uh, Next is blood tests. Next, we have epigenetic testing or DNA methylation. And we have telomeres. All right, so how do cells measure energy and defend against aging? It turns out there are three primitive biochemical pathways, internal monitoring systems. And this is very nerdy, so I'm okay if you zone out for a minute. One is called AMPK that monitors glucose and ATP energy levels. The next is mTOR, which measures how much animal protein, less is better, and fasting, more is better. And then sirtuins, which are monitor NAD levels and inversity, help with wound healing. So AMPK, mTOR, and sirtuins. These are the three critical systems that are responsible for aging. And it turns out three of the supplements I already mentioned to you, nitric oxide, NMN, and Hinokial, all activate all three of these pathways. And frankly, if someone says, "Hey, I've got a new anti-aging medication or supplement or process," my first question is, okay, explain to me biochemically what they do. And if they don't help any of these pathways, I'm like, how can this be anti-aging? So specifically, these three supplements improve and activate AMPK, mTOR, and the sirtuin pathways. And here's another fun fact. Fasting, when you fast, you see almost the same biochemical effects, positive effects, as when you exercise. So I don't normally recommend that you fast, say do a 10-day water fast and then exercise at the same time because your body will break down muscle, which is normally not good. But both fasting and fasting and exercise are have almost identical effects on cells. All right. So how is AMPK, as an example, stimulated? One way is hunger, another is exercise. And then there are prescription drugs like metformin, and then there are also over-the-counter supplements like berberine. And I recommend you try all these things. Okay. So what are some key targets to prolong lifespan and health span? You want to look at blood vessels, mitochondria, the three primitive pathways I just mentioned. You also want to reduce what are called zombie cells. What are zombie cells? Zombie cells are, you think, oh, when your cells get old, they just die. Well, sometimes that's true. But sometimes they stick around. Instead of dying, they stick around and they produce lots of inflammatory factors, which are not good because that inflammation will lead to aging. So there's specific supplements that have been developed to get rid of these zombie cells. And what is senolytic? It's a Greek term meaning lytic means destroying and seno means life. So they basically destroy the zombies. All right. And then you want to stimulate your stem cells with exercise and fasting. And you want to reduce toxins. So there's other Greek term called hormesis. Basically, what doesn't kill you makes you stronger. We're not designed as people to spend all day lying in bed and never getting out. We're designed to be out there, to be active. And that's, it's not just humans, it's life in general. All right. So zombie cells, also known as senescent cells, lose their identity and they stop dividing and they produce all this inflammation. Okay. So as Anna Coulter mentioned, qualia. Qualia makes a senolytic. That's one of the ones that I recommend. And here's the list of ingredients. And the two highest ingredients are antioxidants, fisetin and quercetin. You only take these pills 2 days back to back in a month. So that's one approach. All right. Whole plants. You want to eat whole plants. You want to avoid processed food. And adversity is good. I know it sounds weird, but abundance is bad in terms of, we're in an abundant society where literally you can 24/7 have as many calories available to you as you want. That's not good. That's not what our ancestors had. And our repair systems become complacent if we're spending all our time just putting in calories. This is an important concept. Another Greek word, autophagy, which basically means to eat yourself. When you fast, your body breaks down damaged proteins for fuel. You want to have this recycling process happen. You don't want damaged proteins. But if you never fast, if you're always having 3, 5 meals a day, high calorie dense, your body's never going to get to do this autophagy. The autophagy does recycling of deformed and aged proteins. And then there's the concept of xenohormesis. You want to eat food that's stressed, like hydroponic growing, because then there'll be increased amounts of antioxidants in the food. And this is a key point. You want to live long enough to reset your biologic clock as the technology advances. So the Yamanaka factors won the Nobel Prize back in 2012. And then Steve Horvath at UCLA showed that he was able to reverse human biologic clock by 2 years. And you may be like, yeah, Dr. Josh, 2 years, like, why is that? Should I be excited? 2 years? No, no, you don't understand. He was able to turn back people's biological clock by 2 years, and then 2 years later, turn it back again. So if every 2 years I can turn back your biologic clock by 2 years, essentially you're not aging. Now, in this model, he used metformin, prescription drug, growth hormone, also prescription, and DHEA, which you could potentially get over the counter in the United States, at least. Am I saying you should all run out and get metformin, growth hormone, DHEA, and follow that exact protocol? No, but but this is not just a concept in some other animal. This is in humans. Now, for every year you stay alive, you get an extra 3 months due to the advancing technology. This field is exploding. tons of money, resources going into this area. Soon, I think within 5 years, you're going to get an extra year for every year you stay alive. So, for example, Jeff Bezos at Altos and many others have been put billions of dollars. Like Dr. Horvath left UCLA and he joined this company, Altos. David Sinclair at Harvard Med School has come up with the epigenetic information theory of aging. And what's interesting is he's found that there is a backup copy of the useful epigenetic uh, information in your cells that can be used to rejuvenate cells. We don't yet know what this backup copy is, but the fact that you can have a really old cell, but within that old cell, there's a blueprint to make that a young cell again. That's really exciting, I think. Exciting because then we can regenerate. I'm a big fan of stem cells and exosomes, which are produced by stem cells. Now, stress. We want to decrease the amount of stress that we're under. Specifically, we want to reduce the bad stress, and you want to activate good stress. All right. And regular relaxation or meditation cuts in half the risk of obesity. And we know that obesity increases your rate of aging. So regular meditation reduces the risk of obesity by 50%. What are some things that you can do to relax? Meditation, yoga, breathing exercises, qigong, tai chi. There's so many. There's no right answer for everyone. Everyone needs to try different things and find out what works specifically for them in their lifestyle. So other ideas, breath work, laughing, connecting to others, listening music, playing music, self-compassion. There are supplements that can help, like magnesium, epigenin, and lavender essential oil. Keeping a journal, getting enough sleep. Sleep's really important. Meditation can prolong life. It can reduce death rates by 23%. I like a type of music and device called New Calm that uses neuroacoustic binaural audio. Um, I like using the deep sleep setting when I go to sleep or if I'm feeling really anxious. Unfortunately, I'm not normally anxious. You can find it at nucalm.com, nucalm.com, and discount code again, Dr. Josh, DRJOSH. Okay, I'm also a fan of Brain Tap, which uses sound and visual. I like Dr. Joe Dispenza and his breath work. But again, you try different ones, find what works for you to manage your stress. Now, for sleep, I can give a whole lecture on sleep, and maybe next year I'll be invited to do so. But to sleep, you want to optimize levels of serotonin and 5-HTP, those chemicals. Sleep is essential because when you sleep, and specifically the N3 deep sleep, your brain is able to clear out the amyloid. You can consolidate memories. It's okay to take naps up to 90 minutes. So you get physical restoration during sleep, mental restoration, energy conservation, health promotion, and you can monitor sleep with devices like Oura Ring or Apple Watch. There's so many different options, but at least right now in April of 2025, these devices are not as good as a formal sleep study. So if you're really worried about your sleep, go get a formal sleep study. You can even do those from home now. It's cool how technology is advanced. So I'm really optimistic about this whole field. And what's interesting is that people who are optimistic often live longer. So I really appreciate that everyone is joining me today in this really exciting field. So going back to talking about toxins and longevity, this is also a whole different lecture, but one of my favorite supplements to remove toxins is N-acetylcysteine, because N-acetylcysteine is a precursor of glutathione, and glutathione is the master detoxifier for the body. And then I also like glutathione in topical form where you rub it on your skin. It's called, I like one from a company called ROAURO wellness.com. It's called Glutaril because it's bound with a glucose that helps the glutathione get through the skin. RO Wellness, AURO wellness.com. And again, of course, discount code Dr. Josh. All right. So I'm also a big fan of light or photonic energy. We're designed to be around light because light strengthens mitochondria. It increases the coherence between the heart and the brain. Um, I'm I like this company called Illumis, ELUUMIS.com, where these photon balls that help you harvest this light energy. Again, discount code Dr. Josh. All right. And then on my website, you can find many more endorsements on longevity, more than I can cover in this lecture. I've mentioned Cardio Miracle. I mentioned NAC. There's another exciting one called Revasca that helps repair the endothelium, the lining of blood vessels. I know Anna was asking about it. So I'm a fan of Revasca for fixing your blood vessels. In addition to nitric oxide, I'm also a fan of MetaPower essential oils. And I just mentioned photon healing and some of my favorite supplements beyond what you've seen here. You can find my fullscript.com link on drjosh.com. And let's see. And then you already saw the link to echonugenics.link/drjosh with code Dr. Josh. Specifically, the Honopure and the Pectisol will both promote longevity. And then avoiding hospitals. I spent decades in my medical training and then working in hospital emergency rooms. And I can tell you, there were very few good things that happened in hospitals. Sure, I saved people's lives. That's a really good feeling. But if you can avoid going to the hospital, sure, childbirth. Now, I know people can have children outside the hospital, but apart from childbirth, there really weren't a lot of joyous occasions that were happening at hospitals. So if you can take the right steps to avoid getting these chronic diseases that require you to go to hospitals, then you're going to be much happier long term, in my opinion. And then community, you really, as humans, we're designed to be part of a community. And what's interesting is that modern society seems to have fractured that. I remember growing up, I knew my neighbors. I don't, unfortunately, don't know a lot of my neighbors today, and that's not just true for me. It's a lot of this country and this world. So what I would say is on this longevity journey, try to find friends or family who are willing to go on this with you. Try some of these lifestyle changes. It will make it a lot easier and more rewarding in my opinion. And I love how the real truth about health is it's an online community, but definitely seek out community. And yeah, it's definitely easier to promote your own longevity in a community with others. And I think someday we're going to see baby boomers or even assisted living homes with people who want to continue doing some of the actions that we talked about here. Because, if I try to pitch some of this information to like a nursing home, they'd be like, oh no, our goal is to get people to stay here, not to reverse these diseases. All right, so let's go back to the summary. The top 10 ways of making aging optional: eat plants, exercise, avoid processed foods, reduce your stress, smart supplementation. Again, I talked about a ton of different supplements. I would just start one at a time, and the four I would look to start with would be NMN, nitric oxide, Hinokiol, and Pectisol. We have fasting, optimizing sleep, tracking your own health, avoiding hospitals, and finding a community. here's my contact information, my phone number, my email address, my website, which is just drjosh.com, drjosh.com. And if you can reach out to me if you want to get an age reversal consult. And yeah, so I wanted to thank you all for being an amazing audience. And I'm really looking forward to reviewing your comments and um, so definitely put your comments and questions in the chat here. And I know I have a bunch to go over, but it looks like I have another 30 minutes to answer your questions, which to me that's the most fun of this. So in a little bit, I'm going to stop sharing, and um, there we go. Of
All right, great. Thank you so much, Dr. Hellman. We appreciate the
course.
that you shared with us. Now, if I mean, I've got some questions, but if you want to go through and pick some of the audience ones, you're welcome to. Um,
Sure. Let, let me do that in 1 second here. Okay, so we have um, at what age does the brain start to deteriorate? Some say after 40. I would say, unfortunately, we're seeing the toxin exposure expand. People are being exposed to these fatty toxins in utero, so before they're even born. Um, and one of the key things for brain development is human interaction, not looking at a screen, not watching a TV show, not binge watching Netflix. It's human interaction. And unfortunately, in around COVID, that whether it's 4 or 5 year time period, I saw a lot of human interaction go down. So uh, I I don't think there's a magic age 40. I think we should all be cognizant of it. I think whatever your age is, we can't whether you're 20 or 80 years old, a lot of it is attitude, and we should be focused on it that way.
Dr.
Um,
Based on your answer, is it a lot like all of the diseases, where diabetes now might as well be called, juvenile two, onset, where people are getting younger and younger who are getting these diseases that used to be considered of advanced age?
100%. Many of these chronic diseases, we're seeing it earlier and earlier age. I'm seeing Alzheimer's, more cases and a lot earlier. And there are a lot of reasons for it. But I think one is we're making more chemicals in plants, and those chemicals, plastics, etc., are getting into the environment and then they're getting into us. So that's not the only cause, but we really need to be fighting back. And I respect people who say, "Oh, I just like a natural approach." The thing is, let's just go back to a state of nature. Unfortunately, we can't go back right now to a state of nature. There's there's glyphosate Roundup in the rainwater around the world. There is no place you can go to get back to the way toxins were hundreds of years ago. So that's why I think just like technology created this problem, I think technology can help us try to fix it.
And people like Brian Johnson, who has a tremendous amount of resources and he's doing his best to stay young, is he able to avoid or these toxins or detoxify himself from these toxins?
I think he is, but if you there's a recent video from him on a trip to India, and he didn't even want to go to India because it's so polluted there. So basically, with him, not only did he wear a mask, he brought in heavy duty air filters wherever he went, and he cut short an interview he was doing outside because it was so polluted. But the interesting thing is, just as India has much more air pollution, the United States, our food supply is worse than India's. So it's not that India's bad, America's good. It's we're all in this together. We all have slightly different issues, but air pollution's an issue in the United States. It's just worse in India. Um, so um, so yeah, this is a we basically need to try to fix this ourselves. If we're going to rely on industry or government to fix it, it's not going to happen. It's got to be a grassroots movement, and that's what I like about Brian Johnson is he's spreading the word around the world, and sure he's selling supplements, he's turning into a business, but it's a business of getting people to follow like what he's doing, creating a community of like-minded people who don't want to die.
Thank you. And is, it's obviously it's great. I think a lot of us here are trying to maintain our health, our health as we age. There's an idea that I've heard Michael Pollan talk about orthorexia, where people have an obsession with eating right and almost to a point of it being a bad thing. Can people go drive themselves crazy? Brian Johnson's probably on the I would say I think we probably would both agree is on the extreme, whether or not it's worth it or not, we can discuss, but it's on the extreme of that. Is that a healthy mentality to be obsessed with everything that you do with that?
I don't think it is. So I think you raise a good point that if hearing this presentation for an hour and a half, your reaction is, wow, I'm super stressed. I need to do all of this right now. And if I'm not perfect, I'm gonna die. And and then you can't get anything done or you're super stressed. That's not the right approach. The right approach is to try to find some support and maybe every week or every month pick one area and try to improve it. But yes, there are definitely people with eating disorders, etc., where it turns into a disorder. But the flip side is, I would say the fact that 93% of Americans are not optimal metabolically, that's not healthy either.
Mhm. So, when you were in school at Harvard, what was the nutritional training that they gave you?
Sure. So in medical school, we had maybe a day or two. It was specifically about memorizing the vitamins. See, the way this works in medical education is they will normally teach to the test. So on the standardized board exams, there'll be questions about vitamin D and vitamin B1. So of course they have to cover that in the medical school curriculum, but it was very limited, maybe 1 or 2 days in the preclinical. And then on the clinical side, once you went to the wards to the hospitals, there were classes specifically on how to write IV nutrition, intravenous nutrition, because that is a high you can bill a lot of money for hospitalized patients to give them IV nutrition. So that, but even that was maybe spending a day. So really in medical school curriculum, very little. I learned the nutrition information I now know from having 2 degrees in biochemistry, and then see within the last dozen years seeking out reading with my knowledge reading the articles and trying to figure out what's real and what's just marketing hype. But the average physician doesn't have a degree in biochemistry and is not getting this information. And I would say a lot of it's anti-information, false information that like somehow you need to eat animal products to be healthy. That's just not true, but it's just repeated over and over in the media and in medical schools, so people believe it without questioning it.
And we have Dr. John Abramson. I'm not sure if you're familiar with his work. He has a book called Sickening. He actually taught at Harvard, so you may have run into him over the years. I don't know.
I,
Um,
I didn't, unfortunately.
well, so he talks about how the peer-reviewed journals have been captured, and basically how the pharmaceutical industry has captured the whole information system, and that 60% of all the funding comes for the peer-reviewed journals come from the pharmaceutical industry by purchasing reprints. Um, so how does one find the truth when even the so-called gold standard of medical information has been so captured and adulterated by profit, essentially?
Yeah, so I think your claim is true that much of medical training is now captured by big pharma. And again, I've got nothing against prescription medications. To me, I'm integrative. I use them, but and then operations or procedures. With anything natural, which you can't make a lot of money off of in terms of a patent product, gets ignored. So so for that reason, I think people need to be skeptical of the whole process and understand. So like I said, I think it's amazing if you can have a double-blind placebo-controlled study demonstrating something. But what's interesting is when you're dealing with industry-sponsored studies, you can tweak those studies basically to show whatever you want, unfortunately. With you designing the right subgroups, etc. So what I would argue is on a you need to give more weight to things that don't have billions of dollars promoting it. Just like I mentioned, olive oil is a $1 billion industry. There's a lot of money promoting, getting articles or advertising, etc. But there's no broccoli lobby. There's no lobby saying you should eat broccoli sprouts. And frankly, there are some studies showing that the health benefits of broccoli sprouts, but they're not mega studies involving thousands of patients because those are expensive studies. And who's going to put the money up for those studies? So what I think you have to do is take a step back and not put to the wayside natural products that don't have a $1 billion budget to promote. And
Oh, no, no, I'm sorry. I didn't mean to
yeah,
interrupt you.
so to my mind, the correct approach is integrative. Not to say, oh, all drugs are dangerous, all procedures are dangerous. No, but what are some natural things we can try first? Let me give you an example. Sleep. I would much rather someone try magnesium supplements or lavender essential oils first to get to sleep than a prescription medication like Ativan or Benadryl, which long term we do know that those medications will lead to um, potentially dementia or Alzheimer's if you're chronically taking those things.
So you just spoke about olive oil and the impact of it being backed by a multi-billion-dollar industry. Um, Coffee is so often touted as being so good for you. And even a lot of the doctors that I follow will talk positively on coffee. I know Dr. David Amen, he actually had a very similar statistic as far as blood flow. I don't know if you're familiar with Dr. Amen's work.
Yeah,
He,
Daniel Amen.
oh, Daniel Amen,
Yeah,
sorry.
Daniel Amen has. I love what he does in terms of popularizing um, the SPECT scans. Of the brain. I'm more of a fan of a more modern approach called PET scan, but I love the fact that he's out there to the public talking about brain health and what different drugs will actually do to the health of your brain. So from in terms of getting the information out, I love what he's doing. And but let me just say with coffee, it's a double-edged sword, and let me explain why. If you look at coffee, coffee turns out to be the number one antioxidant that Americans take in. So if I go out there and say stop taking in coffee, I'm potentially hurting people because unless they're finding other sources of antioxidants in fruits and vegetables and grains, then they're actually hurting. So the caffeine in the coffee is not good. But again, this is the average American's like, I want a quick fix. What's one thing I can do? And yeah, so there are nuances here. And so, if you I'm not a fan of coffee, but don't give up the coffee unless you start eating more fruits and vegetables.
But it actually kind of reminds me of, like I mean, I would assume, and correct me if I'm wrong, that it is the number one way that people get their antioxidants because they're not getting their antioxidants anywhere, basically. So therefore, coffee, which does, may not be, has enough, is the number one. But it reminds me of like, oh, well, people are eating a certain number of vegetables, but they're potatoes and in the form of French fries, right?
Exactly. And the French fries, the more you take a starch, the more you fry it and add oil, you're creating acrylamides, which are neurotoxins and cause cancer. And and again, just look, the financial incentive is the processed foods, the French fries that sure they taste good because of the added salt, oil, and sugar, but they're not health promoting. But you can make a lot more money selling French fries than just selling potatoes. So that's where the commercial interest. I mean, I'm all for capitalism, but we need education to let people know like you shouldn't be eating the foods that are highly processed because it's going to come back to bite you in 10, 20, 30 years.
You mentioned dioxins being stored in the fat, and once they're stored in there, they stay in the fat. What happens when you lose weight? Do they come out into the bloodstream?
They do. And so one of the key times that you want to be doing a detoxification is if you're losing fat, because you're exactly right. These fatty toxins, as the fat cells get smaller, specifically the visceral fat that's around your organs like your liver and your kidneys and heart, as those visceral fat cells get smaller, the the fatty toxins in those fat cells get released. And unless you've got a strategy to get them outside the body, they're just going to find another fatty tissue, whether it's the brain or other fat cells, to go in.
So what is that strategy?
So it's several. So one would be, I mean, the most extreme would be total plasma exchange, where you actually take blood out. So that's one. Another one would be using intravenous phosphatidylcholine, which can push some of those fat cells, and intravenous glutathione, or even topical or oral glutathione. Glutathione is this master detoxifier, 3 amino acids. And then other approaches would be sauna and exercise, colonics. All those things could help push some of these toxins out of you.
Great, thank you. You mentioned mycotoxins, black mold toxins. How do we get rid of them?
It's the same way. So, um, with all these, you don't the first thing you want to do is detoxify using glutathione and phosphatidylcholine, because many of these toxins are trapped not just in fatty tissue, they're also trapped in biofilm, this biologic film. So, for example, parasites or Lyme spirochetes or other bacteria will form a biofilm to protect the bug from our own immune system. So the thing is, if you're doing things to bust the biofilm and push out these mold or mycotoxins, if you do it too quickly, you can actually get a lot worse, because what you're doing is you're releasing all these toxins that have been stored up over decades, potentially within a day or two or three. And that can hurt the liver and the kidneys and the pancreas. So, one thing I would emphasize is you want to go low and slow. You may hear there's like, oh, methylene blue is a great way to fix your mitochondria and kill bugs, and it may be, but go low, go slow, do it under medical supervision so you can monitor your liver and kidneys and pancreas so you're not actually doing damage.
Thank you. You mentioned donating blood as being good for you. Can you explain a little bit more why?
Sure. So when you donate blood, think about what happens. You're taking blood out of you. And if you happen to have some of the pesticides, fatty toxins in your body, some of those will go into your donated blood. So that's not good for the person getting the donation, but it's good for you, especially if you're donating it on a regular basis. There's a good comment about iron. If a lot of people have too much iron, if you're iron overloaded, then what can happen is when you donate blood on a regular basis, you're lowering your iron levels. And there are certain aging processes where we know that oxidized iron, especially heme iron from meat or fish, can contribute to premature aging.
Great. And just to go back to the caffeine conversation, um, is caffeine the same in everything? Like if you have like coffee, tea, cacao nibs. So if it's, does it drop your the blood to your brain by 27%, like you said?
Yeah, so it's dose related, right? So normally chocolate is going to have less caffeine than coffee will. Um, but the other thing is like if you look at cacao nibs, it may not have much caffeine, it has some, it has other stimulants like theobromines, etc. So yeah, remind me the question. I mean, there's nuance here, so it's hard to.
Cacao. Basically, I was getting to one of the audience members' questions about cacao and its caffeine. Is that as bad as coffee?
Yeah, so it does not have as much. I think cacao would normally have, maybe 8 milligrams of caffeine, and coffee might have 100 milligrams. But there are other stimulants in cacao. So I'm not saying never take cacao, but I'm saying, within reason. Um, and instead of coffee, I recommend teas. And specifically, I like teas that are based on foods that you would actually eat. So peppermint, you would normally eat peppermint. And what type of tea are you having today?
This is actually bourbon. No, this is lemon balm. And then just because I'm crazy, I've got turmeric. I can't, it keeps on disappearing, but I've got turmeric root at the bottom of
Yeah,
it.
so you can definitely eat turmeric root. You can eat Melissa or lemon balm. Um, you can eat peppermint. I'm not as much of a fan of teas that the black teas because not only is it caffeine, but you normally wouldn't eat black tea. But if you could eat peppermint or other mints or it it's if it's something you can eat, then there's no reason, taking a tea would be good in that too.
So lemon balm is you can eat lemon balm. Is that or you?
I mean, I'm a fan of lemon balm or Melissa essential oil. It's antimicrobial.
Okay.
So, but yeah, I'm normally a fan of it. Not like a lot of these antimicrobial things. I don't know you necessarily want to take lemon balm every single day, but I wouldn't be opposed to it.
What's the impact of fried food and how does air frying differ?
Yeah, so fried foods is basically, well, if you're frying in oil, that's not good. And then I mentioned acrylamide before with French fries. It turns out that the acrylamide production is dependent on two factors. One is temperature and time. So when you're frying in oil, you're going to reach a much higher temperature than if you're going to air fry. Now, if you air fry a potato, are you going to produce some acrylamide? You will. It's just a lot less than when you fry it in oil. So, um, yeah, it's I don't want people to get crazy about it, but if you're eating fried food now, cut it out and focus on steaming. Steaming is probably a much better option. But look at our society. If you go out to eat in a restaurant, they normally won't say the food is fried, they'll say it's crispy. And so for some reason, if you call something crispy, it's health, it sounds good, it's health promoting. No, crispy normally means it's fried and it's not good. So you basically have to play games. The advertising industry, the food industry is playing this whole game with our health, and you have to basically fight back. And yeah, it's an issue if you want to eat out. A lot of the food when we eat out is not health promoting.
So seed oils get right now are being extremely vilified. Are they distinctly bad for you compared to other oils?
I think they are, but again, it's like I said, I think butter is even worse for you. But look how butter is used in our society. So, but there's a nuance here. As an example, olive oil. Technically, olive oil is also a seed oil, meaning if you look at the preparations, they're often using olive seeds to produce the olive oil. And as I mentioned, there's the AGE, advanced glycation end products. And if you look how these oils are normally transported, they're normally transported in plastic, which is not good. And often, if you study the commercial olive oils available, they have high levels of lead. So it's not health promoting. Now, is olive oil better for you than, say, cottonseed oil or canola oil? Yeah, maybe a little bit, but they're all toxic. So, you know, what I would say is try to cut back or reduce or eliminate adding, instead of cooking with olive oil, use water sauteing. Water's not toxic.
Great. You mentioned about the technology allowing us to catch cancer early. And Michael Greger did a series about the early testing. I'm not sure if you're familiar with his work. And
Yeah, I love his work. I mean, I love his videos. He's an amazing source of knowledge.
yeah, absolutely. And he had mentioned that a lot of times with this earlier testing, they're finding things that are, quote, cancer that people would die with, not of, and that it would
True.
take potentially hundreds of years to develop into something that could kill them. Is that a concern with these early cancer tests?
Sure. I mean, yes, the more tests we do, for example, if we get a whole body scan, we might find a little something in your lung, which could be an early cancer, or it could just be a cyst that or a scar that could be, left there and be perfectly fine. And then if I put a needle into your lung to do a biopsy and look, I could collapse your lung and cause problems. So the answer is there is a risk of doing further testing, but I think the benefits outweigh the risk. So if I do a blood test, say the Gallery test on you, and find that, wow, it looks like here you've got in your blood, it looks like you've got cancer stem cells that look like they have a source from the lung. You better believe I would recommend that we image you and try to find the source, because lung cancer, like so many other cancers, have a much better outcome if we start treating it early. But I understand the argument, but I would rather be proactive and um but just understand going in that, yeah, you may have some unnecessary procedures, but you just have to weigh the risks and the benefits.
Yeah, I believe Michael Greger did I think it was a 10-part series on mammograms, and his conclusion was that it was essentially a wash, and that, as many people that get saved get harmed and often suffer egregious harm, such as death from them. So I'd love for you to watch it. Maybe next year we can
Okay,
chat about it.
sure.
So a question from the audience: how can we grow back shrinking gums as you get older? Is there
Yeah, it's
anything?
fascinating. I've seen good results using NMN, and specifically the powder. Because if you think about the NMN, nicotinamide mononucleotide powder, you want to put it under your tongue, or you're going to get much more exposure of the NMN to your gums. So I've seen regeneration of the gums using topical NMN powder. And then the dose I recommend people start with is 1,000 milligrams. Maybe start 500 milligrams when you wake up and 500 milligrams at around noontime.
Great. And I'm just looking to see if there's any more questions from the audience here before I go back to my
Yeah.
question.
So
Uh,
DA is like, what do I think about taking glutathione versus NAC? I like both. NAC is a precursor to glutathione. I'd recommend taking both. They're both so important. I mean, one question I often get is I talked about many supplements that improve the three primitive pathways, and they'd be like, well, why take more than one supplement? Because often different cells will be optimized with different supplements. So that's the reason to double up or triple up sometimes.
and what are your thoughts on coloscopies? Colon,
Colonoscopy?
colonoscopies. Yes.
Yeah. I mean, I think colonoscopies can be indicated. Again, you have to look at your pretest probability, but you also have to look at the risk. What are some of the risks of colonoscopy? You can have a perforation. It's rare. It does happen. Number two, often with a colonoscopy, you're getting exposed to petrochemicals in the form of the anesthesia. So, um, I'm, but you also have to look if you have a high family risk, if everyone in your family had colon cancer at an early age, yeah, I think it makes sense. Also, look at your diet. If you're eating, plants that are not processed, your risk of getting colon cancer is a lot lower. So you have to balance out those two. I'm a big fan of stool testing and specifically their Cologuard, where you're looking for DNA changes from cancer cells in the colon. So what I would say is b- keep abreast of these new technologies and don't be afraid to use them. But it's hard to give general advice because, if someone's eating a Western diet, I say, yeah, you probably need it because you're at high risk not just of getting colon cancer later in life, we're seeing it earlier and earlier. Now, if you want to do instead or push it off a year and instead do the Grail test or the Gallery test or another test like that, sure, it's not FDA approved for that, but have a conversation with your physician, weigh the risks and the benefits. I want an educated person. And what really makes me angry is many times these procedures, there's not full there's not full consent. There's not people don't know all the risks and the benefits.
Right. Actually, we're having a conversation like about that with Pam Popper, talking about that with Ozempic. People aren't told the extreme risks with that, so they don't really have informed consent. What are your thoughts on hyperbaric oxygen treatment?
I'm a big fan of oxygen therapy to reverse aging because hyperbaric oxygen improves the function of mitochondria. I've seen it firsthand help with reducing certain toxins like carbon monoxide and cyanide poisoning. I've seen it help with wound healing, but I've also seen it help with other infections. But it also is good for reversing Alzheimer's, preventing Alzheimer's, and improving mitochondrial function. So I'm a big fan.
And does it matter what type of like chamber you go into? It's the hard one versus the soft one. Is there anything with that?
Sure. So the soft one is normally going to be a lower concentration of oxygen. We normally live around 1 atmosphere of oxygen. The soft one might get you up to 1.3 atmospheres. The hard shell chamber will get you up to 2 atmospheres or higher. So two is going to be better than 1.3, but either one is better than one. So, and I've seen much better results doing hyperbarics or oxygen on a daily basis. So again, whatever is convenient or whatever works in your lifestyle.
Great. We have about a minute or so left. We'd like to leave the audience with what gives you hope in reversing age.
Yeah, so what gives me hope is, as I mentioned, the huge amounts of money and resources and time that are being placed into this field. So, and we're starting to see results. And I love the fact that this is being pushed by the general public. So, as you can tell, I'm very optimistic. And I think literally within 5 years, aging will be reversible because we'll be able to permanently turn back people's biologic clock. Whereas now you have to exercise every day and you have to do all these supplements. I think our options are going to increase exponentially every year in the longevity field.
And do you think it'll be available to maybe not in 5 years, but in the long term, will be available to the general public, or would that be kind of part of the wealth disparity?
No, I think like any new technology, it's going to be more available to the wealthy than the poor. But just like any new technology, it will slowly filter in to everyone. So, right now to get genetic therapy, you have to go to another country and and but also be a guinea pig. It's not just money. We're talking about people like Brian Johnson. He's risking his own life doing these treatments but yeah, like I'm really excited. So yeah.
Okay. Well, I appreciate that. Well, thank you so much for all the information that you shared with us today on reversing aging. If we can unmute the audience so they could share their appreciation for Dr. Hellman.
I know.
Good
Oh,
job,
great.
Dr.
Awesome.
Could never be available.